Hey everybody, this is Dr. Moises Salama at Labiaplastic Surgery. Today I'm going to talk a little bit about labiaplasties and vaginoplasties. The purpose of a labiaplasty is to remove the excess labia minora, which is the skin that's in the perineal area or outside of the vaginal opening. So I use what's called an edge trim technique to remove the excess. Basically the excess labia gets marked, it gets numbed with local anesthesia, and we remove the excess tissue and close it with sutures. With a vaginoplasty is different. The goal is completely different. It's basically to tighten the vagina and the vaginal opening. So we make the lumen, which is the inside of the vagina, smaller by bringing the muscles of the pelvic floor together. It's almost like doing a tummy tuck inside the vagina. So we bring those together with sutures. We remove the excess mucosa to make the volume smaller in that area. We also tighten the introitus, or the vaginal opening, by bringing some other muscles or the transverse perineal muscles together so that the vaginal opening will be smaller and the woman can achieve more pleasure through intercourse. Candidates for each of the procedures. Typical woman who comes in for a labiaplasty complains of excess labia minora tissue that gets stuck on their clothes, that it's large, it looks like butterfly wings. For a vaginoplasty, typical woman is a woman who's had several children, is no longer achieving pleasure through intercourse, complains of looseness, that she doesn't feel her partner during intercourse. For the recovery of each, we tell patients not to have intercourse. As far as working out, most patients can go back to working out 3-4 weeks after surgery. Immediately after surgery, we just tell them to keep the area clean. They may have some mild watery discharge after a few weeks as the stitches start to dissolve. After 6 weeks, we tell patients to try to come back for an exam to make sure that things have healed okay before they try having intercourse. And then I usually tell them to start very slow because the areas are still inflamed and they can start hurting if they start having intercourse too fast. As far as water activities, I usually tell patients to stay out of a pool or the ocean for the first 3 to 4 weeks. Thank you guys for all the questions. Please send us some more and be sure to like, follow, and subscribe.